Guys, my name is Jocelyn Arredondo, and today I'm going to be talking about alcohol and drug use among college student adult children of alcoholics. In the paper, they compared drinking and drug use in adult children of alcoholics, ACOA, and non-adult children of alcoholics, non-ACOA, college students. The principle of the study is to see if having a parent who they suspected abused alcohol and did drugs led them, the ACOAs, to do the same. Some prior research in 2002 showed that it estimated that 31% of 8 million college students had fallen under the category of abusing alcohol. Abusing alcohol, also known as heavy drinking, is considered as 5 or more drinks in one event in a single month. In 2005, a study found that 33.5% of college students used marijuana and that 15.5% used a different type of drug. There are many factors that result in excessive drinking. Those include availability of alcohol, peer pressure, college students not knowing self-control, etc. Family history is also another huge factor for alcohol and drug abuse. In the paper, they conducted 6 hypotheses. The first one is ACOAs would be drinking at an earlier age than non-ACOA college students. The second one is ACOAs are more likely to drink alcohol than non-ACOA. The third one is ACOAs would drink more heavily than non-ACOAs. The fourth one is one or both parents of ACOAs alcohol abuse would cause constant alcohol use for the college student. The fifth one was ACOAs would begin illegal drug abuse earlier than non-ACOAs. And the sixth one is ACOAs are probable to illegal drugs than non-ACOAs. Now for the method. There was 572 undergrad students in a U.S. university that qualified as ACOAs and non-ACOAs. 122 were male, 450 were female. 31.2% first-year students, 27.9% were sophomores, 24.8% were juniors, and 14.9% were seniors. 55.2% were white, 29.2% were black, 6.8% were Asian or Pacific Islander, 2.8% were Hispanic, 0.3% were Native American, and 5.6% indicated other for ethnicity. Now for materials, they used the CAS test, which was a Children of Alcoholics screening test, the alcohol use, and a socio-demographic questionnaire. For the CAS test, it is a 30-question survey that determined if the student lived with an alcoholic abusing parent during their childhood. Some of the questions that they answered with yes or no. Some of the examples of the questions were, did you ever wish that a parent would stop drinking? Another one is, did you ever feel like hiding or emptying a parent's bottle of liquor? Every time they answered with yes, they got a score of 1, and every time they answered with no, they were scored with a 0. So they were all added up at the end in order to create a total score. A score of 0 to 1 meant that the student did not live with a problem drinking parent, and a score of 6 or more meant that the student did live with an alcohol abusing parent. Those who scored 2, 3, 4, 5 were unaccounted and were not used in the overall analysis. For alcohol use, they reported what age they started drinking, how was their current alcohol use, like how many days you have at least one drink containing alcohol, how many drinks do you have on a typical day during the school year. And lastly, for the socio-demographic questionnaire, they just filled out their age, ethnicity, marital status, and year in college. So for the results, age, sex, and year in college and ethnicity were all viewed as covariates. ACOAs and non-ACOAs age did not really vary. Ethnicity also did not really differ in ACOAs and non-ACOAs. ANOVAs that were conducted revealed that the person's ethnicity predicted the age of the participant's first alcoholic drink, how many alcoholic drinks the participant had per week, how many alcoholic drinks the participant had in a school day during the year, and the most alcoholic drinks they had in one day in the last 30 days. A chi-square analysis showed that there was no correlation between sex and drinking status. Results continued. ACOA categorization and self-identification as a current drinker were not significantly related. Regression analysis were used to decide if ACOAs and non-ACOAs were different in age of first alcoholic drink, how many alcoholic drinks per day per 1 week, how many alcoholic drinks on a school day when drinking alcohol, and the most number of drinks they had on one occasion in the last 30 days. Non-drinkers were a combined result of those participants who said they were non-drinkers or former drinkers. The rest were considered current drinkers. Regression showed that ACOA categorization demonstrated that ACOAs tried their first drink 0.82 years earlier than non-ACOAs. ACOA categorization did not predict how many alcoholic drinks participants had in one day in a week, how many alcoholic drinks the participants have a day in the school year, or the most number of drinks they had in one occasion in the last 30 days. 4 regressions were used to determine if a father's, mother's, or both parents' alcohol abuse led the participant to drink alcohol regularly or abuse it. Participants that suspected their mother had a drinking problem and did not help when predicting age at which they started drinking, how many drinks they had in one day in a week, how many drinks in a school year, and the most number of drinks they had in one occasion in the last 30 days. Participants that suspected their father abused alcohol helped in predicting how many drinks they had in one day in a week. That came out to a prediction of 0.89 more days than participants that used alcohol during the school year. However, it did not correlate with the age that participants first started drinking, the amount of drinks that they had in a day during the school year, or the most number of drinks that they had in the last 30 days. Results continued. 102 participants were considered current user of illegal substances. There was no correlation between ACOAs and drug use. 24% documented occasional use of illegal drugs, while 16% of non-ACOAs reported occasional use of illegal drugs as well. Linear regressions demonstrated that ACOA arrangements did not correlate with predicting age first used. Those illegal drugs include marijuana, ecstasy, speed, cocaine, crack, painkillers, salvia, LSD, 2CI, 2CE, acid mushrooms, PCP, also known as angel dust. For the discussion, there was no crucial correlations between sex and suspecting one's mother or father of alcohol abuse, the age that participants first started drinking, how many drinks they had in one day and a week, how many drinks they had in a day during the school year, and the most number of drinks they had in one occasion during the last 30 days. ACOAs started drinking a year earlier than non-ACOAs. ACOAs did not start drug use earlier than non-ACOAs, but they were more likely to use them. 24% of ACOAs stated that they use drugs compared to the 16% of non-ACOAs. ACOAs who thought their mother or both their parents had a drinking problem reported more that they were drinkers in comparison to those ACOAs whose father had a drinking problem. Instead, those whose fathers had a drinking problem reported that they had more days of drinking. Mothers drinking made it more probable that daughters drank more, and ACOAs were more likely to follow their mothers drinking, women drinking alone or in their home. ACOAs began drinking earlier than non-ACOAs, but not more deliberately. ACOAs did not start using drugs earlier than non-ACOAs, but were more likely to be current drug users. Alcohol abuse in parents was correlated with illegal drug use in college students, and those whose mothers that would abuse alcohol had a different association with alcohol than those whose fathers had a drinking problem. The main focus of the study here was if ACOAs would report earlier and heavier drinking or drug use than non-ACOAs. 64.9% of these participants were underage drinkers / binge drinkers. And yeah, that's it.